Do you have maybe one particular dog or one particular guardian that was maybe a tougher case than you expected, and then either the dog had a light bulb moment or the guardian had a light bulb moment where they saw sort of this science-based training being effective?
Yeah, actually, one of my dogs I talk a lot about. I have a lot of videos, and I've done a lot with them. I worked with them for over 9 years with that particular dog, and then their other dog. She was an Italian Mastiff, close to 130 pounds worth of dog, very young, impulsive, came from a puppy mill, which they didn't know. And so health issues and skin conditions and, cherry eye and just all kinds of stuff happened. She wouldn't eat very much, and they were like always trying to always had diarrhea for like the first year in her life. And they finally got her physically healthy, and then they needed to take care of her cherry eye, and they were going to spay her all at once. And then she got an ear infection, and all that happened at the same time, right around a year old. And so they took her to the vet, and they did the surgery on her eye and everything. And then she needed to have drops in her and her ears because she had ear infection, all like 8 times a day with everything. And 130 some pound dog look at her people who are not dog handlers, and Mama is tiny. She's maybe 110 pounds. The dog weighs more than her. Husband is very athletic, but he's in a wheelchair. He's a Olympic wheelchair tennis player. This dog decided to say, no, you can't touch me with that stuff, and I will bite you and I will mount you when you come near me. And so then the big dilemma of, should we keep this dog? What do we do with her? Rescue won't feed her the way she needs to be fed. And so I'd worked with her off and on, mostly was working with our little dog and a little bit with her. And they said, we'd like to discuss her life. And so we talked about euthanasia. We talked about, going to a rescue group, and what it came down to, they were willing to spend the time and money to hire me to see if we could get past this problem. She wouldn't eat. She would check out. She would shut down. I had like very little to work with when I started doing an intensive program with her. And so we had to pre-mac eating. She would play with her toys. She liked that. So I pre-maced her so she would eat. And we got her to the point where she became a huge pig about food after that. That became very exciting and fun for her. So it was really neat to have that. I taught her to wear goggles first, so I could be around her head, not intrusive and things. And then we switched to a full-on muzzle. I have video on clickertraining.com of muzzle training of her just like putting her face, coming across the room and shoving her face into a muzzle. It was so fun for her. And that just transferred to tons of different things. And then we worked on all her reactive behaviors that she was displaying, a lot of it because she wasn't feeling well. But she would go after skateboards and some trucks and cars and definitely other dogs and people that looked weird, like hats and things like that. So, she's a guarding dog, so some of that kind of built in there, and plus puppy mill made it worse. And sick, she wasn't able to retain a lot of the puppy socialization things that we did as a puppy. And so we kind of did all this remedial work. I worked with her for about 3 months, every day, 2 to 3 hours a day, with lots and lots of breaks, obviously, and lots of fun. And she turned out to be the most fabulous dog. And with them, she died last December. Not a very long life, 8.5 years, but big dog. And it was just a fabulous experience working with Gaia, and the successes that we had with her, and the love that came with the family after she learned some skills, right?